I reckon it's going to blow a lot of people's minds to even think that there is a reciprocal link and a connection between hearing and sleep.
That essentially what's happening is because you're not able to hear as well as you used to be able to, your brain has to work overtime.
I actually can improve my memory. I mean, that's really quite phenomenal. Hello, welcome to Resonate the podcast. I'm your host, Lesleigh Smith, and this is a show where science, stories, and wisdom all meet together. This is a New Zealand-based podcast about thriving, not just surviving as we age, and why hearing is far more than just our ears. Each week, we will explore how hearing, brain health, cognition, sleep, memory, balance, and human connection are deeply intertwined, and how early action and prevention matter far more than people realize. This isn't about living longer, it's about living well. In today's first episode, this is our very first episode, we're starting with a really big idea and one that sits at the heart of this entire series. That hearing is actually a gateway to healthy aging. Good hearing is not just about picking up sound, it shapes how our brains actually work, how we connect with others, how mentally sharp we stay, and how engaged we remain with life. But yet, despite all that, hearing is still probably the last frontier in research, and it's the most overlooked part of well-being. My guest today is here to talk more in depth about hearing and his ideas on changing the entire hearing industry in New Zealand to improve access and outcomes for New Zealanders. My guest is James Whittaker, founder and CEO of Resonate Health. James is a disruptor and a thought leader in the hearing space. And he's someone who passionately cares about making high-quality hearing care more human, more accessible, and more affordable for everyday New Zealanders. Together, we're going to talk about why the way we access hearing care in New Zealand is broken, why hearing matters far more than people think today, and how better hearing can support brain health, memory, and to truly thrive as we age. Now, this is a very, very special day for us because this is our first episode. James, welcome to Resonate the podcast.
Thank you very much indeed. Thanks, Leslie. It's an absolute privilege to be guest number one, I have to say. So thank you for having me.
Oh, delighted. Now, before we get into anything technical, I just really want people to get to know you a bit better. So tell me, how did you get into this industry? What made you interested in hearing to begin with?
Okay, so 17 years ago, I stepped off a plane with my wife and 3 children. We decided we wanted to come to New Zealand, and we had done that on a tourist visa. So we didn't have a job to go to or anything like that, but we absolutely knew we wanted to live in New Zealand, having come on holiday the year before. So I needed a job, and I needed a job really quickly because I had about 5 months' money in my pocket. So after about 10 days, I was in an interview to head up an audiology company.
Right.
And somehow I managed to get the job, which was fantastic. And I've never looked back since. I think the fun part of that is I asked my boss as he became, about a year later, I said, what made you give me the job? And he said, the other 2 were better and more qualified than you. But I just thought that you would have a more human approach to the business. So anyway, it was a company called National Hearing Care, and that was my first foray into New Zealand audiology. And I think they like to say I was drinking from a fire hose because I knew nothing about audiology. I come from an airline industry, but I'm absolutely fascinated with it and loved it ever since. And that's why I'm still in audiology.
Fantastic. Now, coming from out of industry, as you just said, like what surprised you most about the hearing industry?
Yeah, it's interesting because there's government subsidy in New Zealand. There's government subsidies. I was very surprised about how fixated the business was, essentially on the transaction of I need to find somebody with a hearing loss. I get the funding, get them hearing aids, out the door, you're gone. And I found that quite troubling. And we spent a lot of time trying to work on what would great customer service look like. At the time, they were called clients, not customers as we call them now. But it was trying to work out, well, actually, I'd like to break that model and think about it from a more human perspective, much higher levels of touch, and not see them as a production line of people coming in, getting their funding and off they go, actually to try and change the dynamic, because if they had an even more amazing outcome, they're more likely to tell people about it. So that's the journey we went on. Not easy, because clinically, things have been done the same way for 40 odd years. So we changed a few things in the early days, but I'd like to say that we probably changed most things in Resonate.
Yeah. So I was just going to ask you a bit more about that. So it sounds like what you learned about the industry, you felt like it was only serving people to a point and you wanted to go that next step farther. So tell me, why did you start Resonate?
Okay. So I think the subscription model that Resonate revolves around is the key component. It's only one element of the big change that we're trying to make, but I think it's the key component because with subscription, you can't ever relax on the level of customer service that you have to offer, which is why we actually call them customers, not patients or clients, because I'm trying to change the dynamic. So with a subscription, where they can hand those hearing aids back at any time, you're only as good as how your last appointment with them or your last interaction, whether that's an email, a telephone call, or whatever it is. But that keeps you honest on the customer service. Whereas what I call old audiology is bring them in, get them to the point, whatever that is it 1 month in or 2 months in, you're signed off, customer says they're happy. But ultimately, at that point onwards, that person is a cost to the business. And so people think of it differently. Bringing somebody back in who's an existing customer is a cost. Whereas in the subscription model, that's all value add because they're going to subscribe for longer. So obviously we're thinking of lifetime value.
Right.
And so exquisite customer service has to be at the forefront.
And the definition of exquisite customer service in the Resonate model is not just fit and forget, but it's that ongoing lifetime.
Correct.
Everything and anything that you need.
Everything that you need. But I think that's where the transparency comes in as well, which is before you've ever stepped foot, more than likely before you've ever stepped foot in a Resonate studio, you've already done your research. You know exactly the product you're going to get. This is why these things are so important that you can't take one element of the business model in isolation. The whole thing is beautifully wrapped together to make sure each component works. So picking one product that was the very best technology we could get with one price meant that you could be hugely transparent, put all the power in the customer's hands now because they're no longer sitting there going, well, I don't know what product I need. What is the audiologist going to recommend? How much can I afford? All that's gone. They know exactly what they're going to get when they walk through the door.
Right. Oh, that's interesting. I guess a little bit controversial, but there will be some people out there that might say that one make and model, even though it is quite high quality, may not suit all people. So what would you say to those people?
Don't disagree. Don't disagree at all. So Resonate was never founded to look after 100% of the people. I don't think any business can. You have to understand what is the market that you're looking to penetrate or develop and grow, and what is your business model, and does it have a big enough market? They call it the total addressable market to make it viable. And we looked at it and I was absolutely convinced that there was a viable business model for us to be able to have this business model. But we have notes on files that say when somebody came in, so before we used GM Resound, when we first launched Resonate, didn't have a cross device. Some of the other manufacturers did. So we would refer down the road to another audiology provider that we were happy with to go and get the cross device. There was never a problem in doing that. What we wanted to do is to satisfy the majority. And I understand that there will be a certain preference in sound. Different manufacturers have a slightly different type of tone. And I'm not an audiologist, so I'm taking this from audiologists telling me this. But customers have a different perception of sound. That's absolutely fine as well. If the WS Audiology are doing a product that sounds different and the customer likes it better, well, the beauty of the subscription model is they're coming in, they can sign up, and for whatever reason, they can leave that subscription model and they're not bound in, they're not tied in. Right. So I feel very comfortable with that. I would love to be able to address even more of the market, and we're trying to do that by making it accessible because 60% of people in New Zealand that need a hearing aid aren't wearing one.
And that's exactly where I was going next, that it sounds like the overall model in New Zealand, the industry itself and the funding, perhaps, there's something that's broken. So what do you think happens when people delay going to get their hearing tested? Like, is it still a problem that people delay and don't go in when they should or wait too long?
No, there's no doubt about that at all. And because of the way we capture insights from the customers that we're fitting with hearing devices, and because there's only one product, it's amazing to benchmark because we're not trying to second guess were they in the X level of quality or the higher level of quality. Everybody's wearing the same product. So that makes research for us really easy. So, but the number of times that I read, oh, I should have done this sooner. Oh, I should have done this sooner. That's a challenge. But I think the other part of it is that, and we're now seeing this not just in New Zealand, but globally, people are putting off the re-aiding cycle. They're slowing that process down. And that's the barrier. So there's a barrier to entry on the way in when you're a new wearer because of the cost of the product. But then there's also now a barrier, which is those people with the repeat prescriptions. Now in New Zealand, that's every 6 years. I think that's a bit broken, which is why we do an upgrade as part of the subscription service at 3 years. Because if you look at the evolution, we're already on the 4th generation of GM ReSound product, and we've only been open less than 3.5 years. So therefore, the argument to me is keep pace with the technology changes. It's only 6 years in New Zealand because guess what? The government provide a universal subsidy every 6 years. It's 5 years in Australia, or it's 4 years in other countries. So that also, to me, makes it sound like the industry is driven by the funding regime, not like by the customer.
Right. Yeah, and you think about how often people will upgrade their iPhones or their cars even, or, things like that. It does, the repurchase cycle seems to be a lot faster. So you've mentioned cost as a barrier, and there definitely is a perception out there that hearing aids are very expensive, and so that will put people off. You've also mentioned the funding here in New Zealand is every 6 years, so then that might dictate when people generally, historically, have gotten new hearing aids. What about stigma? Do you think that's still a problem in New Zealand?
I think it's to some. So we look at customers in persona groups because it helps us try and define better how we might support them. So one of those persona groups is the hard-headed denier. And the hard-headed denier is somebody that, they're not all male, but there's a proportion of people that are male, and they don't want to do something about their hearing loss, even though they know there's something that's going on, and they've probably known that for years. So I think we do still have an element of stigma, but what I've seen change certainly in the last, I'd probably say it's since about 2018, 2017, even before that slightly, I should go back actually 2014 when GM ReSound launched the Made for iPhone. That was the very tip of the iceberg for me, where the connectivity with your device, your Samsung or your iPhone, started to change the reason for using the hearing aid outside of just hearing in noisy environments. So that, I think, has started to break down the stigma, which is, yes, I have something behind my ears that in the old days made me look old, but now actually I'm totally connected. I'm listening to my podcast. I'm taking my calls. I'm doing all these things. That's helping. I don't think we're there yet. I think we've got a long way to go, but it's certainly helping.
Yeah, you make a good point there. I grew up in a deaf family, and we used to have to talk to my grandmother through this teletext machine. And now we can just send texts, and there's no stigma attached to that. It's all very straightforward. So you're right. If you could use your hearing aids or hearing devices just like a hands-free headset, it takes away that stigma.
They're incredible products now.
Yeah. There is still that she'll be right kind of cute mentality a little bit. So I can see we still have a little ways to go there.
We have people that come and join the subscription and then tell us that they don't perceive the benefit from the products. And because I also look at that information as well, you do scratch your head to some degree where people are wearing hearing aids, and we prescribe hearing aids because they should be wearing them. They have an aidable hearing loss. I think the challenge we still have is there's a lot of effort that needs to be expended by the customer. And I think as an industry, sometimes we don't set the expectations clear enough. And I say industry because we can only do our best through the research that somebody does on our website and the conversations that you have when you come into the studio. But as an industry, I'm not sure we're as transparent as we need to be about saying this is not that easy, because I think the industry is worried that that's going to put off the number of people that are going to come through the door, and therefore it even makes life even harder because you've got to sell a product that's quite expensive. And now you say to them, oh, and by the way, it could take up to 3 or 4 months for you to really get used to wearing this product. Nobody wants to say that. Whereas I think we need to flip that around, because I think once you understand there's a journey to be had, and if you go on that journey, the other side of it is amazing. You're reconnected, getting back in touch with society, etc. But I don't think we do a good enough job on that.
And that is the advantage with the subscription model, is that, you're not paying a huge amount of money upfront to commit a month in, for example, but still haven't finished your journey of 3 or 4 months. So at least with the subscription, you can keep going along that path and fully get there. Now, I reckon there's still a lot of people out there who are like, meh, hearing, don't really understand why I'm even listening to this. Why is this of interest to me? How is this going to change the world? How is this going to help me live better? So I just wanted to introduce, just to pause here and introduce a kind of a bigger concept. I reckon it's going to blow a lot of people's minds to even think that there is a reciprocal link and a connection between hearing and sleep.
Yep.
Hearing and balance, for example. If I improve my hearing, I actually can improve my memory. I mean, that's really quite phenomenal. So from your perspective, let's just start with memory. What do you think, just as a high level, what's the connection between hearing and memory, or hearing and dementia? What do you think?
Okay. So the way I understand this, and I've been interested in the Franklin work for years and years and years. I remember having conversations. I very clearly remember having a conversation. I think it was in 2011, 2012. So his study hadn't been going that long by that stage, starting to think about how this could absolutely revolutionize the way people think about it. So what we now know, to my layman's terms explanation for the purpose of this, is that essentially what's happening is, because you're not able to hear as well as you used to be able to, your brain has to work overtime. So your brain working overtime puts extra stress and pressure on it. That makes you feel more tired. So what happens is there's a compounding impact, which is then you think, well, that's a tiring situation, so I won't go into that situation. So then you start to withdraw. And it's the social isolation, they believe, that really speeds up the cognitive decline. So if there's anything that you take from this first podcast of thinking about healthy aging for yourself, is stay connected, stay in touch with your friends, go out, push the boundaries, go for walks and have conversations. All of those things combined have a massive impact on your healthy aging.
The way I understand it is, like, you wake up in the morning and you have like a certain amount of energy or resource for the day. And if you're spending your energy and those resources to try to understand the message that's been said to you, forget it. You're not going to have enough energy left over to actually remember that message, or you might start off at the beginning of the day pretty good, but by the time the end of the day comes around, it's you don't have as much energy left over for that. So, yeah.
Well, can I give you a highly personal example?
Yeah.
So in 2010, my parents first came to New Zealand to visit us, and because I was running a hearing company at the time, I sent both of them off. Mum and Dad had a test each. Both had mild hearing loss. Dad went on a journey with hearing aids, which lasted quite a long time. My mum didn't. She was definitely in our hard-headed deniers category. Today, Mum now has dementia. She's been diagnosed about 18 months ago, and she's currently in New Zealand with us now. So that's why I say it's a very live, very personal example. I don't know whether her wearing hearing aids when she was told that she could benefit from them in 2010 would have had a major impact on today's outcome and obviously her diagnosis. But watching her and her interactions of somebody who has not gone on board with hearing aids and gone past that barrier. She has hearing aids, but she is still a sporadic user. And I can see how isolated she is. And because we all know the topic and the we're all in the industry, we're all trying that much harder.
Yeah.
But it's so key and so clear that if you start to have that withdrawal and removal, it's very hard to get back in after it. And I can see how physically tired she is as well when she's not then getting that assisted listening. So I think that's another great piece for us to all take away from this is this is an industry, but these are real, genuine, life-changing outcomes for people that we see on a daily basis.
Yeah. And there is some research out there that indicates that even if you have been diagnosed with early cognitive decline or you are high risk of that by improving all of your senses, and hearing is the most significant one. So make sure you have your best prescription glasses, that you're fitted with hearing aids if you do have a hearing loss. It actually offsets the trajectory. So you can delay and be fitter for longer. Or even if you do end up with cognitive decline, that the symptoms can actually be a little bit less, which is phenomenal.
Yes,
Yeah,
amazing.
yeah. And so, yeah, that link. I think Helen Keller once said that if you lose your hearing, this is not a direct quote, but paraphrasing, if you lose your hearing, it cuts you off from people and connections. But if you lose your eyesight, it cuts you off from things. So it makes it more difficult to navigate around and whatnot. But definitely that connection with other people is huge. And you think here in New Zealand, culturally, we have a lot of storytelling through the years. So it's really ingrained in our culture to interact with people and, get out in community. Okay. So hearing and memory. So jumping from there, what's the correlation with hearing and sleep? That one surprises me.
Yep. Well, can I jump up a level? Because I think you've touched on the thing that probably was one of the litmus tests for me when I first thought about Resonate. So I didn't actually want to talk to people about their hearing loss because of the stigma we talked about earlier on. So you bringing in the reference to sleep, I always thought sleep was very intriguing. So the amount of research and the balance, the connection between the two, it goes actually back to cognitive load, as my understanding again, which is that you're basically, if you think of your brain as a CPU unit, you've basically put some new software in it. The computer fan's going like mad in the old days. It's spinning around and the computer's overheating. It's the same. You're putting a lot more load, and that makes it much more difficult for your brain to then get itself ready for what is essentially that period of time when it starts to relax, compartmentalize things, get you your REM sleep, get your other stages of sleep. So sleep is impacted by the fact that essentially you're overstimulating your brain, as I understand it. So that research is probably the one where there's a lot now going on in comparison to before. Frank Lin obviously started his longitudinal study a long time before. So that's why I think we've got so much more around cognitive decline, social isolation. But I think we're going to get a whole swathe of information coming through, because the other thing is we all know that sleep is extremely important for health generally,
in general,
but also healthy aging. And the reason I started with sleep is there's most people you ask over the age of 45, how are you sleeping? They normally go, oh, not that brilliant. So it was my sort of Trojan horse to having a conversation about hearing health because of the link, but also people are more comfortable talking about sleep, perhaps even tinnitus, than they are. So that's where the whole concept of Ear 360 came from, because I think hearing is and should be tackled as much more holistic, healthy aging exercise than just let's do an audiogram, loss, no loss. It's a binary outcome. To me, it's not a binary outcome at all.
Yeah. And it's I'm glad you mentioned Ear 360 actually, because that's where I was going next. And to a lot of the listeners out there, they won't know what Ear 360 is. So one of the ideas behind Resonate Health is that hearing shouldn't be, as you just said, simply about a hearing test and then a device. Because we're not walking around just two little ears with nothing in between, right? It's what we're looking for, I guess, is more of a holistic assessment of the overall person's health and well-being. So tell me, just high level, how would you describe Ear 360? What is that?
Okay, so now I need everybody to kind of, listening to the podcast, you've got to shut your eyes, you've got to visualize something, because I think it's the best way to do this. So you've got a Resonate Health studio, right? It's already called Resonate, not Resonate Hearing. So we already start with a much more general thought process. If you look at our website, any of our branding, it's very ambulance at the bottom of the cliff.
Right.
So the principle here is we're here to support you with more information so that you can make a very informed decision. Okay, so now here's the visualization. I want you to think of two doors as you walk into a Resonate studio, not one. Okay. So one door is, I'd like to find out more about my hearing healthcare, and that's the Ear 360 door. And it also might be wax removal, because we do that service as well. But essentially, that's that door. The other door is, I know I need to sort out my hearing. I've done my research, and I know you have a subscription model for hearing. It's got as it is at the moment, the ReSound Vivia 9s. That's the product. I've done my research on the product. I'm happy with it. Okay, I'm turning right. Okay. So that person turns right. They've made the decision. They're going to get an audiogram done. They're going to go through the fitting protocols that we have with REMs, et cetera, and everything else.
Right.
But
REMs being measurements that you do in an ear with a hearing aid.
Standard practice
Okay.
For us. So, but if you turn left, that's a whole different world. So that's not a world of, oh, you've come in for a comprehensive hearing assessment. We're going to see if you've got a loss to try and then sell you a pair of hearing aids. We're not actually really interested in doing that cross-sell at all. In fact, it doesn't really exist in our conversation internally. What it's about is thinking, okay, there are comorbidities associated with hearing. We maybe attracted your attention because you're thinking that you need to do something about this. So if you're an early adopter in health conscious, you're probably doing it for that reason, or you're somebody that might have had some kind of free test in the past, but not enjoyed the experience or not gone further in that experience. Right. Now you can reset, come in, go through Ear 360. Takes at least an hour for us to do that. Every single one of our diagnostic rooms has to be 18 square meters, which is huge. And we're sitting in one right now, because you need to be able to take a certain number of paces in order for us to do our balance test.
Right.
So
so you literally stand people up and walk them around the room somehow.
You literally do a balance test, and all of the elements of Ear 360 have been exercises that are already out there. And what a chap, and I know you're going to talk to him later on in the series, so I won't say his name, but I will, just in case it's a secret. But essentially, I sat down and said, I need something that starts with people thinking about their sleep, looks at the comorbidities, tackles this cognitive decline in a really human way, but also is very clear that there is the link. And so therefore we do a cognition test as part of Ear 360 as well. Now, we also look at elements of hearing loss in that. So we do extended frequencies, which is now, I'm hearing on the wavelengths is becoming more common than it ever was before. But I've seen a bit more. So we go all the way up to 12,000 hertz, whereas most people stop at 8. And the reason you stop at 8 is that hearing aids normally can't really support you much more past 7 or 8. See, I know enough to be dangerous in audiology. But what you are then doing with the extended frequencies, you're maybe finding out a little bit more about some other subjects that are related. So it could be you're actually got somebody that potentially needs an APD referral, for example. So Ear 360 was always intended to be completely holistic, and it was never intended to be free. And that was a big key point for me, and actually a very scary point for me, because before we launched Resonate, we brought a whole group of the public in. Didn't know what they were coming for. They just knew they were coming to talk about hearing. And we went through a focus group and talked to them about Ear 360, all the components of it. And then we asked them to price it, because everybody else gives away free diagnostic. Well, not most people give away a free diagnostic as a loss leader into getting hearing aids. And the range of costs or prices that they put was so broad. And so when we launched, my comfort zone was $99. That actually, for what we do, I still think is incredibly good value if I compare it to any other medical assessment that would take you an hour. But I think that that's a key component, which is going left is not about hearing aids, no hearing aids. It's about wisdom, knowledge about hearing healthcare through Ear 360. Pictorially, you then get a map of your hearing, and each part of it has a score. So I think that's also really important, because I think that's easier for the customer to understand than an audiogram.
Right. So the customer comes in and it covers memory, balance, sleep, tinnitus, standard hearing as to what people are familiar with, how clearly they hear, how clearly they hear in background noise, or how well they understand in background noise, I should say, and their high frequency hearing.
Correct.
I think I've captured all of that. And then they go home with a personalized map.
Correct. And report.
For them that says these are the areas that I should watch out for.
Yes.
What if there is an area to watch out for? Then what?
So obviously, if the scoring that we have and the way that the report's been built, there will be gates that whereas it can't be black and white, but there are obviously gates where a certain score will allude to there may be something here where the prescription of a device might help. So, for example, somebody with a high tinnitus score and potentially one or two other elements where they perceive that, whether through the testing or their own self-reported, that a device might be required, we would then prescribe a device. But it is absolutely not how many people can we get from Ear 360 to wearing hearing aids. That's not important.
Okay.
And we measure that number very closely, because I've always said I don't want too many people that actually leave an ear 360 needing hearing aids, because we'll have got the job wrong. The job here is awareness.
Right.
So if a high percentage are going on to getting hearing aids, you're just creating awareness for people that probably already needed hearing aids today and should have turned right in the first place.
Right. Where
we want you to turn left.
There could be somebody who perhaps needs to go and get their balance seen to and see a physio for strength training. I'm just
correct. We have a referral model for all of those things. But now you have a score in each of those 10 areas. Now the ideal is that we encourage you to come back every year, every 2 years, whatever it may be. So now
baseline, and
absolutely
you can do something about it and build on that going forward. 100%. Right. It's an interesting concept. It kind of reminds me of some of the latest DNA tests that tell you if you're have a tendency towards some kind of food intolerance or something, or some kind of genetic risk in the future, then it lets you, it's like a signpost, right?
It's a leading indicator.
Yeah,
that's
exactly. Right. It sort of reminds me of that, where, great. Well, there you go. So hearing truly is the gateway in that,
yes.
in that towards looking after your entire self and your well-being. Fascinating. Cool. Now, just taking a little pause here for the listeners, we will go into the science behind the Ear 360 test, because it is unique in the industry and it's something that's proprietary to Resonate. So in a future episode, we will do a deep dive explaining in more depth the link here, and going into, I guess, more detail into how hearing can affect and be affected by other parts of your overall health, and how it can add or detract in other areas. So basically what I'm hearing with Ear 360 is that the holistic wraparound assessment gives better insights into what people can do to take control of their own health, and can sometimes even prevent or offset further issues so that they can live their best lives. And is that essentially what it is? So that they can improve their overall quality of life?
Absolutely. And the idea is to get you thinking about healthy. It keeps coming back to, so when I was doing the research before we launched Resonate, one of the things I looked at closely was what's called the span of life. And so the idea here is we're trying to enable people that come and do the Ear 360 and eventually, because almost everybody needs hearing aids at some stage in their life, is that you're giving yourself the best opportunity to have the longest span of healthy life. Because the amount of years that you're on this planet does not equate to the amount of satisfaction and how healthy you are on this planet. So the idea with span of life is you're pushing out the healthiest possible time for the furthest amount, and then the shortening the bit where you're not healthy, versus they're living with some kind of debilitating disease or illness over a longer period of time where you're obviously not functioning as you once were. So span of life is really important to me. Ear 360 is part of that. And I guess part of Ear 360 for us and the genesis of it, and thinking about why did we call it Resonate, not Resonate Hearing, is we are a healthy aging company. And I tell people that all the time. We will, and I aspire to have the world's largest database of healthy aging. So that's people who are aging in a healthy way, focused on that. We started with hearing, but I absolutely see us being able to then expand those services into other things that help you age in a healthy way.
Oh, that's really inspiring. That's cool. I think too, the more we kind of take control, because aging as a concept isn't very sexy, and you kind of go, oh, it's inevitable, and you feel like you're on a train track that you can't get off that track, or you can't steer. When in actual fact, it's kind of like perimenopause or menopause, where you're like, oh no, all these bad things are going to happen. But there's a lot of things that you can do to take control. And there's a lot of things to change your own, trajectory and take control where you can. So I think all of this is incredibly positive. So what I'm hearing is it's not hopeless.
No.
There are things that we can do as individuals when we act early, especially, but I'm sure there's no time that's too late. And that people can actually change their own futures, which I think is phenomenal.
And we need to start thinking of hearing aids that are cool. I know that's a stretch. I know there's a stretch, and we talked about stigma at the time, at the start, but you can make hearing cool.
Yeah.
Because if people started to understand the sort of gains that they could have in their health by wearing this product that generally most of the time sits behind your ears, and stop thinking of it as making you look old, and actually give it more of a, we have one amazing customer, and to her, they're these bionic things that enable her to do amazing things that her friends and other people that she's with can't. She completely embraces it. And I think more people just need to think of it like that, which is, it's just a component of living your best life.
Yeah.
And because we don't charge an enormous sum of money up front, that's why I love the model that we've got here, because we're going on a journey with you. And as long as we keep providing you with the outcomes that you are seeking, you keep paying me every month.
Yeah.
And at the point that you're not satisfied for whatever reason, you don't have to pay me every month.
Yeah.
And that's a very simple relationship. It's very important, but a very simple relationship.
Yeah. Yeah. And I do like that long-term relationship. And I think that word relationship is key, actually, because it's people engaging with people going forward. I mean, just circling back to what you said about hearing devices being cool. Yeah. I mean, I personally have worn hearing aids since high school, and how much they have evolved and changed over time is phenomenal. And people, I think, in their heads, if they've never worn hearing aids before, they still think the big banana behind your ear, or the big tube, or like a hunk of chewing gum in your ear. Like they have this concept of it. And then secondly, you mentioned that some people may also feel that hearing aids make them look old. I would counter that you might actually look older or more doddery if you keep mishearing what somebody says and you keep answering the wrong way. Or if you're 2 steps behind and everybody else is laughing at the joke. What kind of quality of life is that?
Couldn't agree more.
So I think you look older if you're not, keeping up with the play. And the new devices, they're virtually invisible, even if they do sit behind your ear in some cases. Yep. So, right. Yeah. And what they can do now is phenomenal. I can wirelessly connect to my phone. I can take phone calls and walk around without my phone in my hand, et cetera, et cetera. So, yeah, they've come a long, long, long way. Okay, so we've talked about the link, surprisingly, I think, between hearing and sleep, memory, balance, cognition, human connection, which we haven't delved a huge amount into. But if you can't engage with other people and engage with your community and your friends, then it definitely has a direct relationship on your mental health. So social isolation and loneliness is a massive problem. We've talked about a holistic assessment called the Ear 360, where people can find out their baseline, target areas to work on, tangible take-home, personalized report, but also tangible take-home things that they can do at home. And we've also talked about, if hearing is the problem, what some of the great devices and services Resonate has to offer. Just fast forwarding to the future, what do you think, as a thought leader in this industry and being really experienced here, over the next 5 to 10 years, what do you think? Where is this going to take us going forward?
Well, I'm a massive fan of high tech, high touch. So probably in about 2012, I thought, is this thing actually going to turn into an online service? Is it teleaudiology? As we barely knew much about it at the time, but could this break the model? Is it going to be a kind of a service where only the top 10% cases come into a physical location? I've completely flipped my opinion on that. So for the next 5 or 10 years, because that's probably as far out as I can go with that thinking, is 100%, if you ask me, this is about the ongoing support and care of your customers through a physical relationship that happens within what we call a studio. I'm not saying that you can't provide services online. Obviously, there's OTC in the States, but if we're all honest, that law change actually hasn't probably changed things that much.
OTC being over the counter.
Sorry, over the counter devices. So. And we do have people researching and coming in and asking us questions about that. But I think the the nature of what we do here is what I think I'm betting the farm on for the future of, if we call it audiology for now, which is you need that high touch environment. You need that environment where you can actually get exactly the outcome that you're looking for with real ear measures, with acoustically treated rooms, not cutting any corners, but having real human beings. So we may or may not get onto AI in audiology, but real human beings that you can talk to. But, and there's a big but here, with a huge amount of support from a centralized customer service team that we call Resonate Connect, because I think it's an absolute beautiful tag team, so that you've got that in-person physical presence, studios around this country or whatever country it is, so it's not too far to travel to get those in-person services. But actually, what happens if you just need something that's a phone call away or a video call away, or you want to do remote assist, so you're dialing in, obviously because of the Bluetooth connectivity? That, I think that will explode. I mean, it will explode for Resonate. Whether it explodes for other businesses, I don't know, because that will depend on how they understand that fitting in with the future of their audiological services. But for me, remote support, remote connectivity is about improving customer outcomes and customer service. Because again, we're a subscription model. It's not about trying to sell the hearing aids remotely. I'm not interested in that at all. Never been interested in that from a teleaudiology model. This is about giving people access to support. Now, I also think that you've got to branch out and go out to the people rather than expecting them to schlep to you. And I can't afford to build a Resonate studio in every small town in New Zealand. So I think there's also some form of mobile model of audiology, for us anyway, in the future, which would be exactly a replication of a studio, but on wheels.
Right. Yeah.
Then if I think about generally and broader the industry itself, is I think that what's happening is the number of people that are being fitted with devices like the devices that we prescribe at Resonate, that's going up, and it was going up around about 6% a year, but unusually it's now 3% a year, 2 to 3%. So it's called CAGR, which is this over a period of time, what is the percentage of growth in your industry? It's really slowing down. That's what I talked about before is I think people are putting sitting on their hands a little bit because of the cost of replacing the product, or seeing it as a cost they can put off. Hearing aids can be your third biggest purchase in your life after your house and your car. I mean, it is a big sum of money. So I think the future will be is that the industry has got to think about this tension of the barriers to entry with the price point, and OTC I don't believe is going to be that bridge. I think they're going to have to think about how accessible their products are at the price point. So I think the future will be a competition between the quality of service that you offer with the price point of those devices. Now there's going to be amazing leaps in technology as well. But if I just take the product right now, we don't need much more for adoption. Right? They have got DNN chips, binary chips in some devices. They've got background noise suppression. They're connected to your phone. They've got Bluetooth connectivity. So I'm not waiting for another amazing explosion and leap in technology. I actually think the leap in technology, or the leap for the industry, is actually how do you support people to actually wear the things a minimum of 8 hours a day, look at that information, use that analysis to better support your customers. And then I think that to me would be a huge breakthrough in the future, where the adoption rates move up to 60, 65%. When you get to that sort of level, you are going to have, that's population health change because of what we talked about earlier on, which is those comorbidities. So that's what I'm gunning for. Where the industry stands on that, I think it's extremely mixed, because most people's bonus revolves around a 1 or 2 years. Most CEOs do 3 to 5 years. That's the way the nature is. So are they going to change their business models that much in such a short time frame? Big question.
It's an interesting way that you put it. If you helicopter back out, there's enough technology in the devices right now to be sexy enough, really. They're virtually invisible. They do everything and anything that you could possibly want them to do. But the price point, the initial price point, if you're purchasing outright, is still a barrier, and people are delaying. So the other thing is, if you purchase outright, and you were other hearing aid retailers, then as you said, once the person purchases, then all of the aftercare appointments later on, service appointments, then become a cost to the company. So to me, it seems that if retailers drop their prices too much, they're going to really put a strain on how much service they can provide. And as you just said, over the counter. So for people who don't know, over the counter are more basic, sort of an in-between between just a hearable and a basic hearing aid. They're kind of a blend where people sort of fit them themselves. Those haven't flown out the door in other markets like the US. So there is something to be said where these devices are not just fit and forget. You can't just take them off the shelf and fit them to yourself and off you go. Some people might be okay like that, but I'd say the vast, vast majority, they need a relationship going forward. So from saying all of that, your model does sound like it wins in all of those categories by making it accessible, lower price point, ongoing service, and ongoing relationship.
Well, and reinforcement, because every subscriber is invited to come back for an ear 360 on us every year.
Right.
So I think it's really important that you continue to reinforce why you're wearing those hearing aids. Wearing the hearing aids just to hear in a background noise situation, which is a troublesome, it's not the main reason for wearing your main reason for wearing your hearing aids is to take down your cognitive load, which is what we talked about.
Yeah. And
so we can encourage you with knowledge.
Stay younger and stay connected.
Correct. So we can encourage you to wear them 8 hours a day minimum, because we keep reinforcing all of those different comorbidities and actually testing and giving you those results, because some of those comorbidities shouldn't get worse because you're wearing the hearing aids, and that's a reinforcement model in itself. So I think it's about the service, it's about the product and the devices. And yes, I think technology is important, which is why we wanted to replace it every 3 years. But more so than that, the warranty runs out at 3 years. So now you just as a customer, you're constantly just in a product that's always being looked after, which was important to me. So it's not just about technology; it's actually about making it simple for the customer and taking away any pain points.
Now, there's one other aspect you haven't talked about, and that's part of what you just mentioned with reinforcing how to get the best out of these devices and why you should wear them longer. And that's your sound advice. So
yes.
Can you tell me a little bit more about that?
Yeah. So as with most things in Resonate, they get conjured up either by me or some members in the team, and then we're pretty good at implementing things fast. So sound advice was something where I knew I wanted to have a connection with the customers, and when we originally wrote our job descriptions, one of the things is that we said that we will be available up until 7 o'clock, and it wasn't because we wanted everybody to work till 7 o'clock at night, but just the vision was there'll be something that needs us to work outside of what I call the normal day, and that would all be focused on the customers. And like anything, you launch and you're very busy on launching, and so it's not, you haven't forgotten about the idea, it's just that the timing wasn't quite right. And then we came back to it about a year ago and started to really think carefully about what it is that we think we can offer our customers. So we came up with what's now called Sound Advice. And it's now every 2 weeks is an invitation to come and join us. Generally speaking, it's between 4 and 6, or it might be 5 and 7, and 1 or 2 locations have a different time just because of the demographic that they're looking after. But ultimately, it's about offering customers and their friends, family, whoever wants to come with them, to come to the studio. So it's in a studio environment, and to learn more about the hearing aids that they're wearing. So we will do sound advice evenings on sleep, or we'll do it on the balance. So we'll bring physiotherapists in. We'll do presentations on the link between, as you were asking me, the link between hearing and sleep, so people can understand more. There's a word in Maori which is called manaakitanga, and manaakitanga is something that is the bedrock of all of our 3 values. And manaakitanga is all about giving before you receive back. So the idea with Resonate was always to give you knowledge, give you insights, give you information. And then when you trust us enough, you'll make the decision to come to us so that we can look after your hearing for the rest of your life. That was always the idea. So Sound Advice is just an extension of that, giving you more information. There's no hook there. You don't have to buy anything. It's a free ticket. But what we're finding is that when we first launched it, there were 1 or 2 studios that might have 1 person come through or 2 people. And we're sitting in our Milford studio, and we had our Christmas Sound Advice, and it's not far from the office where Resonate's based. And so jumped on the e-bike, came down here, spent the time with just an amazing group of customers. And it just reminded me how important it is for that social connection, because obviously we're getting now people together. They're now seeing it more like I'm a member of a club rather than I'm a subscriber to hearing aids. But there was one chap that I talked to, and he was really funny because he said, well, I got your email invitation and I thought, am I going to be the only sook that turns up to this thing? And he says, I walked up the street and I walked past, just looked in the window and he said, there's 25 people in this studio. So he came in, he was one of our subscribers, and I had a lovely chat to him. But I think that's the other thing, which is, I love the concept of it. I love the fact people are learning more about it. But actually, going back to healthy aging, we're just facilitating you actually making connections. And we are now
building a community.
We are creating friends. There's no doubt about it. The people that sat there and had an amazing conversation and spent a couple of hours, it was incredible. It really was. And that is like, I've never seen that in audiology.
It's huge, huge. Yeah. And it circles back to that holistic care and why I imagine you're doing this in the very first place.
And there's every reason why anybody that would be reviewing this from a profit and loss perspective or from an accounting perspective will say, what do you mean you gave away 2 hours of productivity to, but when you think of the context and if you're consistent with it, there is no doubt in my mind that all of these events, if we wait long enough and keep providing you with that information that you then trust us, that the friends of subscribers will subscribe, or we will be creating an amazing brand that more and more people talk about. So all of these things will come back, but it goes back to that window, which is I'm not working in a 3-year time frame. I'm not bonused on how many people come through the door and do a subscription or any of those things. This company is absolutely in the long game of it's generating a population of people. And I love a business writer, a guy called Jim Collins, and he talks about creating this flywheel. And to me, what we're doing is we're not there yet, but we're creating a flywheel that will be self-sustaining as long as we just continue to look after the customers in the way that we've set out so far. And we're 3.5, not half yet, but 3 and a bit years in. And we haven't missed a beat yet. We haven't blinked on still offering that level of care. And I think that's really important because you do get pulled and pushed, and obviously investors want return on their investment and all those things. All of that is real.
Of course, yes.
I'm not an independently wealthy enough guy to just do this in a philanthropic way. But so far we've not blinked on it. And I think we've got through the pain barrier now where all of the things we've been doing are now showing results in terms of the long-term results on the referrals, the word of mouth referrals and things like that, where now I think we are set for the future.
And I think we need to keep having these conversations and keep talking to more and more people, as you said, building friends, just getting the word out there. And essentially this is what the podcast was developed for, right? It's to further the conversation and to have it go beyond these 4 walls. We're sitting in the Milford studio right now, and get the word out there for people. So tangible take home, what's in it for me if I was a listener? So for the person listening right now, they could be in their 40s, 50s, 60s, who thinks, my hearing is probably fine. Why should they care about this conversation? So what's one small mindset shift that you'd love people to just take away from this conversation?
I think if you could just think about what we described, which is your cognitive load, right? Because that doesn't really matter how old you are. So healthy aging to me, it doesn't matter whether you're 16 and wanting to age in a healthy way or 76 wanting to age in a healthy way. So you may think your hearing is fine, but you may have early onset hearing loss that is not particularly discernible, but you may be putting a bit of extra load on it. So why wouldn't you go and find out about that? Because
when you have a mammogram.
Exactly. Or, we're in the Southern Hemisphere where, sunspots and things like that. So, and funny enough, I'm going next week to have my annual MOLMAC check. Why wouldn't you find out about that stuff? And yes, we charge for it. So there is a relationship in there from a monetary perspective, but I'd much rather pay for a service and know that I'm paying for a service to find something out and it not be a tool to get me into a pair of hearing aids. And that's really important to me as well, which is why we charge for it. So take away that healthy aging starts at any age and it's never too early to get your benchmark. And once you've got your benchmark, then you can decide what the regularity is of you coming back, and think of it as the more people I can encourage to turn left as they come through the Resonate door, the better, because that's awareness. I love our subscription product. I love the fact so many people are jumping on board with it. And that's great because that is obviously what pays the bills. That's our bread and butter. But actually, the more people that go and do an Ear 360, I think that will be the success that will transform this industry.
Great. Well, let's pause here and I'll just wrap up with a few reflections. First of all, I just want to say that our purpose today with this podcast was to change mindsets and to have a conversation around healthy aging, to not only reduce stigma, normalize conversations like this, educate people, hopefully in a non-jargon, easy to understand way, and to just build community, as you said, making friends and whatnot. So by furthering this conversation outside the studio walls, I think can be nothing but helpful. And just to give people information to be able to access not just support, but personalized support to live well for as long as possible. Hopefully our listeners have been able to come with us on this journey and have learned that hearing is not just ears. Mm-hmm. It's about overall brain health. So good hearing, good sleep, good balance all directly affect overall brain wellness and function, even mood, mental health and memory. I mean, to be honest, I think that's fascinating, if this day and age with life getting so hectic and stressful and everything, to just think that, maybe just that gateway of looking at my hearing could help things. Yes. That's massive. We learned that paying attention and taking early action for these aspects of health can give tangible items to do at home to improve your outcome and live as well as absolutely possible. We learned that James Whittaker and Resonate Health are thinking of customers as more than just ears and are changing up the industry and changing things to improve access to have better health outcomes for the person as an entire whole. Starting the journey with ears, but person as a whole. As part of this new way of thinking, Resonate Health offers a holistic wraparound assessment called Ear 360. And have a uniquely accessible hearing solution with innovations such as the subscription model. And you do have some purchase outright options as well for those who would prefer that. But there's the subscription model, which makes it more accessible, and other traditional services and options still out there available in the marketplace. So we invite everybody to hunt around and find the option that's best for them. Just to reinforce the role of this podcast is to offer all information to you, the listeners out there, and have you make up your own mind. So please, we ask that you look after your hearing, your balance, sleep and memory if you want to live well and have the best quality of life. Going forward in the season, we will learn about the latest hearing aid technology. We'll learn more about holistic cognitive screening tests, the science behind it, really cool advances with using biomarkers. We'll learn more about tinnitus, sleep, and how to improve your memory and your brain function. So if you, the listeners, if you liked what you heard today, or if you have any questions for James, me, or feedback at all about the podcast, please send us your feedback on our website. That's www.resonatehealth.co.nz/podcast, or email us at podcast@resonatehealth.co.nz. We really do want to build a community of listeners and continue this conversation. Thanks, James, for coming in.
It's been my absolute pleasure. Thanks, Leslie.
And thank you to the listeners for tuning in and joining us on our very, very first podcast. This is really special to have you here. If anything here resonated with you, carry it forward, let it echo into your life, continue this conversation, and share the ideas from today with others who could use it. I'm your host, and this is Resonate the podcast, and I'll meet you here next time.